haven't made a video in a super long time, but I really wanted to make this video. I'm sure you can tell by the title, I'm getting a boob job. I'm so excited. I've wanted this for years and years and years. Also, since the last video I made, I did get engaged. So the wedding is about 5 months away, and my boob surgery is about 2 days away now. So I thought I'd make this video to talk about how I picked my surgeon, my consultation, my pre-op, and some of the prep that I've been doing for surgery. Okay, so to start, I picked my plastic surgeon. I went to Instagram and I typed in, I think, hashtag breast augmentation Houston, and I found a bunch of different plastic surgeons, and I looked at their pages, I looked at their comments, I looked at their reviews, and I looked at their before and after photos to figure out who I thought had the best results. So then when I had one picked, I called her office and I set up a consultation. So I went to the consultation, and the nurse put me in a bra like this, except it zipped up the front. Then the doctor came in and we tried on, well, we had a conversation about what I wanted to look like, and from there we tried on a bunch of different sizes of like sizing implants like this. So she went over what she thought would look best on me, you know, saline versus silicone versus different profiles of implants, basically just all the different types of implants, and then we started trying them on and put them inside the sports bra, and she has this huge floor-length mirror, so I would just stand there and look at what I thought looked best on me. So once I had one picked, we were done with that portion, and then we went over possible dates for the surgery. I picked a date, and then I had to put a portion of money down to save that date for my surgery. So the next part was actually, I guess I'll include this. So at my consult, we were going over sizing, and she was like, I'm going to show you the smallest patient that I've done, her before and after. So I'm like, okay, and she's like, this patient only got 165 cc's put in, and she's like showing me the photos and looking at me. She's like, actually, I think you have less breast tissue than her. Like, yeah, okay. That's why I'm here, to get a boob job. So after the consult was over, we set a date for the pre-op appointment, and this was a two-part appointment. The first part of the pre-op was in my doctor's office, and the second part was at the hospital that the surgery is going to be at. So at the first part in the doctor's office, it started with signing all of the consent forms, which was honestly kind of overwhelming because there's like 20 plus pages of consent forms to sign, all about what can go wrong in your surgery, and you're just signing away that it's all okay. But it's an elective surgery, so like I want to get it done and it's okay. So the next thing we did at the pre-op was put the sports bra back on and put the sizing implants that I picked previously at the consultation back in the sports bra to make sure that this was the size that I still wanted. Then we took all that off and we took my before photos, and I think that was it for that portion. So then I went over to the hospital and had some lab work done for the hospital, and they also went over a few more pre-op instructions for me. They gave me this bottle of antiseptic, antimicrobial soap. So the night before my surgery, I'll wash my whole body with this, as well as the morning before, I'll wash again. A few other things they went over at the pre-op appointment was just some hospital policies about visitors, about who can come, how many people can come. I will need a ride home from this surgery since I'll be coming out of anesthesia and I'll be on some narcotics. So For me, my fiance is still in school and he couldn't get off, so my mom is actually going to be the one to pick me up from the surgery. Um, oh my gosh, no, I forgot. So at my at my pre-op appointment at the hospital, we talked about what medications that I'll be prescribed for post-op. The first one we talked about was an antibiotic called Keflex. This is just to help prevent infections. The next one is tramadol. That's a narcotic, so that'll just be really good pain medicine. The next one is Valium. I'll take that twice a day to help prevent pain and also prevent muscle spasms. And then the third pain medicine is Celebrex. This is more like ibuprofen level pain meds. They also suggested that 2 weeks before and 2 weeks after surgery I take a probiotic. So this is the one that I've been taking. I got it from Walmart. They're sour gummies and they're pretty delicious. Okay, so that is it for the pre-op and consultation. So I'm going to go over some things that I've been doing to prep for surgery. The first thing is my diet. They suggested that I up my protein. I also personally wanted to gain a few pounds before surgery because I was worried that I would lose weight, and I was already on the thinner side of what I like to be on the thinner side of what I like my weight to be. So I did gain a few pounds. So daily I started drinking 1 or 2 protein shakes, also just eating more chicken and stuff like that. Okay, so the second thing I did was order some pajamas. They suggested that I have clothes that zip or button up the front because for at least a week after surgery I won't be able to put my arms over my head. So I need clothes that I can easily slip on and off. So I already had this from my sister-in-law and brother's wedding. These were like our matching bridesmaid pajamas. And the matching shorts. I also bought a second pair of pajamas. They are not in yet. I'm still waiting for them to be delivered, but I'll include a picture here. I think they're from Pretty Little Thing. Okay, so the third thing I did was make sure that I had people ready to help me with my recovery. I'm a little nervous about the recovery because I know that I'm not allowed to put my arms over my head, so like how am I going to brush my hair or wash my hair? I know that I'm not allowed to be driving on narcotics and all of this stuff. I'm not allowed to be lifting or really like using these muscles at all, so I was worried like how am I going to cook my own food and stuff. But it's all going to be okay. I'm going to stay with my parents for at least a week of my recovery until my 1 week post-op appointment, and then I'll probably come back to my apartment here with my fiance. So to prep my childhood bedroom where I'll be recovering, we set up a TV, very important. We also washed all my towels and washcloths so that everything would be clean, as well as we cleaned my sheets and all my bedding just to make sure that everything's clean because I don't want any of the incision like scars to get infected. The fourth thing I did was made sure that I had good food ready for my post-op recovery. So they suggested that I up my protein, and then on my own I've done a little research about what's best for breast augmentation recovery, and people said that increasing your vitamin C, increasing simple carbs for your body to digest. So I've got some food ready to go, some more protein shakes, some orange juice for vitamin C, some chicken, just a whole bunch of good stuff. So the fifth thing I did, which is not at all necessary, but I just wanted them because they're cute, was get these color changing cups from the Target dollar rack. I was worried that if I had a big jug of water, obviously you need to increase your water and be drinking fluids after every surgery. So I was worried though that if I had a big jug of water on my nightstand, that when I would turn to pick it up, that would be too heavy for me to be lifting. And I don't want to be in pain and I don't want to mess anything up. So I got these cups because they were smaller and they're super lightweight and they're cute. So totally not necessary. What are we on? Sixth thing now? Sixth? I don't know. Thing I haven't done yet, but I'm going to do is write up a schedule of the pain meds and how often I need to take them. Because I was watching a video of some other girl on YouTube during her post-op recovery, and her boyfriend was helping take care of her, and they accidentally gave her too much of one of the medications. I mean, she was fine, but at some point that'll catch up to you if you keep double dosing on these meds. So I'm going to be pretty drugged up on these narcotics, so I don't know if I'll remember what I have and haven't taken, especially when there's like meds that I need in the middle of the night, and I don't want to be so tired that I take the wrong thing. So I want to have a schedule ready so that I can check off what I have and haven't taken throughout the day. One more thing I did as far as like prepping my room is that we have this triangle shaped pillow. Post-op, it says that I need to be my head needs to be elevated at least 30 degrees. So I'm going to be laying on this triangle pillow, and I'll probably slide regular pillows up under my arms so that I can just be chilling in bed. And the last thing is that we ordered a lap desk where the legs fold out and they sit over your legs. So I'll have like a tray to sit in bed and eat and do whatever. Okay, well, I think that's it for this video. I'm not going to film much going into surgery because not much is going to happen. I'm just going to arrive and check in and they'll wheel me back. I mean, I can't have my phone back there, so there's nothing to really record. And I probably won't feel well enough to hold my phone up and record myself immediately after surgery either. So I think that's it for this video, but the next video is going to be before and after. So I have swimsuits back here. I'm about to film all the before shots of me in these swimsuits, and then a few weeks after my surgery, when everything is mostly healed, I'll film the after portion and have a nice little before and after video. Okay, bye.